Marijuana, cannabis, addiction is a pattern of marijuana use characterized by many of the typical signs and symptoms of any substance addiction. The technical name for this condition is cannabis use disorder, and it is included in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM 5.1. You might hear it called cannabis or marijuana dependence, cannabis or marijuana abuse, or cannabis or marijuana misuse. These terms have fallen out of favor, even in the medical profession. However, it is taking time for people to catch up, even for some who have been working in the field for a long time. People who use marijuana often think addiction is not possible. But it is important to be aware that you can become addicted to marijuana. The National Institute on Drug Abuse, NIDA, notes that 30% of people who use marijuana will develop marijuana use disorder. Symptoms. According to the DSM-5, the presence of at least 2 of the following symptoms, occurring within a period of 12 months, indicates you may be using marijuana in a way that might cause problems. 3. Continuing to use even when it's causing social or relationship problems, and/or even when you've developed a physical or psychological problem related to using it. Craving, strongly desiring to use marijuana. Developing a tolerance for marijuana, needing more and more of it to achieve the same effects. Experiencing withdrawal symptoms when you run out of or don't have access to marijuana. Giving up or doing less of activities you used to enjoy because you'd rather use marijuana. Using it in larger amounts and over a longer period than you intended. Using it in situations that could be hazardous or even dangerous. Using the drug so often, or getting so intoxicated by it, that you can't get important things done. Spending a lot of time seeking and using the drug and recovering from its effects. Thinking a lot about cutting back or stopping your marijuana use. Without success. Some of the common signs of a problem with marijuana addiction include losing interest in things you used to enjoy, damaged relationships, and being unable to stop using the substance. If you begin to note some or many of these symptoms, it may be a sign that you have a problem. If you or a loved one are struggling with substance use or addiction, contact the Substance Abuse and Mental Health Services Administration, SAMHSA, National Helpline at 1-800-662-4357 for information on support and treatment facilities in your area. For more mental health resources, see our National Helpline database. Steps to recovery. The first step to recovery is often taking a serious look at how your marijuana use is affecting your life, work, and relationships. How closely does your life fit with the addiction symptoms listed above? If you feel like you might have a problem, it means that you are already past the denial stage, where many people get stuck and are unable to take back control of their lives. If you think you've crossed from casual or recreational marijuana use to marijuana addiction, seek help as soon as possible. This is particularly important if you've experienced certain negative effects of marijuana, particularly 4. Changes in your self-image and/or the way you think about yourself or other people, especially if you start thinking that others are watching you, following you, or plotting against you. Extreme changes in mood, outlook, and/or the way you interpret things going on around you. Although these effects can be temporary, marijuana use has been linked to a very serious type of mental health problem called psychosis. 5 Psychosis is treatable, but it is important to seek help as soon as possible. Younger people in their teens and early 20s are particularly vulnerable to developing psychosis after using drugs, including marijuana.